No, it's perfect. You're coming in at the perfect time because your fellow members at LCF are saying that besides giving food packs to the people, now I think your direction is actually looking at testing for the community.
Correct. Yeah, that's great. And I just wanted to make a shout out to Fred from Aboitiz Foundation. I think he's here. Yes, Aboitiz Foundation is also supporting the testing for communities. And then also Aboitiz Group, as a group, we are also supportive. So we are also using antibody testing and PCR as part of our workforce re-entry strategy. So yeah, I'm happy to be here to share, Jopin, what we've been doing.
Right. Okay. So since I think this is an advanced group already, we did not go through the overview, then maybe we can go straight to the parts that we think will be relevant to you. George, if you don't mind, I will ask you to start a presentation with your usual why do this and the mapping, because those are the most important aspects of being part of ARK. And then after George explains that, we'll have Gingay is already doing in the barangays, because I think this is also foremost in your direction. And then a huge part of our discussion can be the medical part, the test protocol, which Dr. Mingita will lead. And then after that, we'll do the Q&A. Is that okay with everybody?
Yes, ma'am. Okay.
Okay, great. Sige, Sam, can we put up the slides of George? We'll start with well, let's start with the ARK first. Let's show how our ARK is sailing. Okay na ba yung ating boat? Malakas ba ang malakas yan? Okay, this is as of last night, correct, Sam?
Yes, ma'am.
Okay, so this is the status of ARK as a project, as a movement. And the members, the companies, the foundations that you mentioned, Helen and Avic, are all incorporated here. About 170 plus establishments, be these foundations, associations, or individual corporations, have purchased 1,014,562 rapid test kits for employee and barangay screening. And then, so just to be clear, Project ARK is a complete protocol that espouses rapid test kit, PCR testing, and a whole series of activities to ensure the safety of our people. So let's go now to George's presentation. Okay, Sam.
Hi, magandang umaga po sa inyong lahat. No? Good morning to everyone, close to good afternoon. So basically, I just want to give you what is the concept of the ARK, no? And what does it mean to be part of Project ARK. So you don't need to pay to be part of Project ARK, to be a member of ARK. There's no fees or anything like that. The most important part of ARK is really the commitment of the companies, foundation or whatnot, to test their workforce on a regular basis. And also part of this, which Gingay will explain later on, is to adopt the barangay surrounding your office area so that we can have more visibility to test more people or screen more people and see the infection rate. Now, basically, I want to illustrate the point. No, I always say this in many of our talks. There are two restaurants, right? The restaurant on the left is focused on, there's a big sign there that says this restaurant or this establishment disinfects on a regular basis, conducts mass testing of their employees on a regular basis, right? Versus another restaurant on the right that doesn't do any of these safety protocols.
Hi, Dave. Oh, bakit?
So essentially, which would give you more confidence, no, as from the consumer standpoint, right? Of course, the easy answer is we all know that the first restaurant on the left will give you a much better confidence in consuming their products and services. So this is really our idea. Our idea is to push our to be able to restart the economy. And by doing so, we need to bring back consumer confidence as well as workforce confidence. So right now, let's say the lockdown is lifted tomorrow and we're able to go back to work. What will your employees think, right? Your employees will still be scared to go back to work, to the factories or to, to the different establishments. If we give them a framework that we will be screening our workforce, and our establishments on a regular basis, then they will have that confidence that we are able to identify as many of the potential positive patients or potential people that we can isolate and then queue for RT-PCR to check whether they're truly positive for COVID. So all we ask for you to be part of ARK is really to follow the protocols that the medical panel has created. And Dr. Mingita, who's here right now, will be presenting it to you in detail later on. Now, once we have that, so imagine the barangays at the LGU level is doing this on a regular basis, which will cover the residential area, and then the companies also will be doing this as a regular basis. So we have a two-step approach to be able to hopefully capture and identify as many people that need to be isolated and then queued for RT-PCR. One of the other distinctions here, which is what the state of New York is doing, Governor Como, is he's actually doing antibody rapid testing across all essential workers. And the reason why he's doing this is he is trying to figure out who will test IgG positive. Dr. Mingita will tell you what that means later on, but essentially for this purpose of this slide, is those that test IgG positive have had exposure to the virus, have recovered from it, and may have antibody, will have some level of immunity. So in New York, they were able to see that when they were doing this for the essential workers, the police force, the firemen, about 13 to 14% had this immunity with them. So basically, they were mapping for the immunity, and they were also mapping infection rate of regions and locations all across the state of New York. So this is essentially what we're trying to do here. And I'll show you later in the next slide on how that mapping will look like. No? So that's basically following our protocols. And after that, what we do is we consolidate that data and we give it to DOH. So we're working with a company called Thinking Machines that does the DOH data warehousing. So this data warehousing includes information from public hospitals, private hospitals, OFWs, airports, basically all of the different sources of potential COVID information coming from different areas, different places, and different sources, different stakeholders, and consolidating it into a data that we can all analyze and give back to the national government and the local LGUs so that they're able to be guided on how we will do the reopening strategy. So next slide, please. So basically, it'll end up to this, right? So this is our goal. Our goal is to be able to regularly test barangays, if we can do all 1,710 barangays in NCR and also barangays in the Calabarzon region. If we're able to map that together with the private sector, which is very critical, no? This tandem of employees and LGUs company owners and LGUs working together, so the entire population, as many as possible, will be able to get tested. No, so we later see Dr. Mingita will show you what is this targeted sampling that we're doing, and then the secondary sampling that we're doing, which is a bit more random. No, so what we want to do is end up with this. So currently today, where we are now in Metro Manila, everything is red. Right, all of the places here that you see are all red because we are on ECQ, right? So what we want to do is really get the true picture of what's happening on the ground, right? So that we can see that we may be able to see that there are areas that may have no COVID or very low COVID exposure. And maybe those areas we can lift some of the restrictions. And in the other areas that are really, really high risk, then the government can see it and can reallocate the limited resources we have, like enforcement, police, checkpoints, aggressive testing, food, resources, and allocate it in those areas that really need it the most. So this is a very simplified example, right? This is only 3 gradients, which is high risk, potential risk, and safe. But really, we can do as many gradients as possible depending on what the government sees fit. Now, it can be 10 gradients, it can be 20 gradients. But the idea is to get visibility, because right now, the only way to beat the virus is so that is when we have a vaccine. But that vaccine is years away, or maybe 18 months or 6 months, right? So we don't know what's going to happen to them till then. So instead of no activity, we need to be able to live with the virus. We need to be able to coexist with the virus. And the only way to do that is, as what the government agrees with, and all governments across the world, is to test, test, test. And we believe that rapid testing in tandem with RT-PCR will be able to give you that visibility. And through the rapid testing, you'll be able to screen more people cost effectively, and scale that to large groups of communities and population. So basically, that's the ARC in a nutshell.
Thank you, George. So, I mean, we really asked George to make a presentation of that portion because as a business person, he identifies very closely with the needs of the people in this room at the moment. So, all right, now real practical example. So we will ask Gingay to tell us or to show us what has already been done at the community level with the examples in Manila, and then maybe we can also see some examples of companies already doing it. Gingay? We
Thanks,
start with the
Joey.
beginning slide though. Yeah,
Yeah,
okay.
thanks,
Thank
Sophie.
you.
Okay, so we're just going to tell you guys about what we've been doing, partnership between private sector, so companies who are already testing their employees, and then they've also decided to adopt a barangay, usually within areas where their business units operate. So the framework is actually very simple. So this is a way where we can operationalize yung sinasabi ni Jopin and yung sinasabi ni George earlier about how we can come together to provide a more accurate mapping of the real level of COVID exposure in our communities. No? So by covering both employees and our general population in barangays. And all of this is in line with the overall strategy of the government to manage the virus, which is really to test, to trace, to isolate, and to treat. So kasama po tayo dun sa strategy niyan. And this is how we are operationalizing it on the ground. So the framework is very simple. Companies can elect to adopt a barangay or partner with an LGU in their area where usually you would select a community where you already have your business units operating. Then Project ARC would give your partner LGU or barangay the protocols, the information kit, which includes instructional videos, the sampling methodology as well to be used at the barangay level. And we would essentially handhold the LGU as they go about preparing to implement mass screening using the rapid antibody test kits, and in conjunction as well with their PCR testing. So we do this, we prepare them very carefully so that we can ensure that when you do your barangay testing, you will have a isolation or quarantine facility identified by the LGU so that you can push patients who've been registered as positive coming out of the antibody screening. And also very important is for those identified from the antibody screening, from those identified there to be positive, you would also have a PCR test center who would be able to process these patients no for swabbing. So it's important to make sure that the antibody testing that we will be doing or that you are doing at the barangay level is part and parcel of the overall health infrastructure no, of the LGU. So we also encourage companies who are talking to individual barangays to make sure that you are also aligning with the LGUs in that area to ensure that your barangays will be supported with this kind of infrastructure. This is very important. We also stress that when you implement the protocols at the barangay level, there are no shortcuts or loose ends. So we need to follow the medical protocols and the sampling methodology to the letter as much as possible to ensure that we are doing the testing correctly, okay, and that we are safeguarding the health and safety of people involved in the testing, and that we are interpreting and managing the test results correctly so that we can be of service to these people who now coming out of the testing want to know, so what's going to happen to me, ano na yung next steps ko, ano na yung gagawin ko. Okay, so we found, based on our actual barangay on-ground experiences, that the testing has been useful to identify asymptomatic individuals who turned out to have current infection and therefore needed to be either quarantined or pushed for PCR swabbing. It was also useful to identify persons who have had or who were infected before and have recovered and have some level of antibody and immunity in their system, and therefore they can safely return to work or can continue safely working and not be at risk as well to others. So it gives us a better picture of what your COVID exposures are at the community level, and this is always complementary to the company testing that employers are doing for their workforces. Okay, next slide, please. Okay, so these are just some photos from some of the barangay testing that we've been doing. So the very first one we did was last April with Sampaloc, Manila. So we covered 15 barangays in this district. So you can see here that they have also a triage setup inside the public school identified by the LGU. And Hospital ng Sampaloc, and they have the complete medical team as well. So there are physicians overseeing the testing, as well as trained medical technologists and nurses who handle the actual testing of participants. You can also see here that they have a reception area and an area where the test participants are asked to fill out the patient data sheets provided by Project ARK, and all of the data on those sheets are after the testing results are done are also then consolidated and sent back to Project ARC so that we can in turn use it for information that's being required by the Department of Health. Next slide, please. Okay, so more pictures from the more pictures from the testing. So you can see the physicians in white overseeing the techs and the nurses who are dressed in green. And very important as well is part of our briefing to the LGUs is that their medical teams must also be well protected. So naka-complete PPE gear. Itong mga ano natin, yung mga techs and nurses. And then we also have the acrylic box in use. So this is for further protection as well. Please note that we are using the finger prick methodology for the barangay testing. And Jopin may have mentioned the validation of the test kits that we've been doing with different doctors and hospitals in Manila. This is also to validate whether the kits can be used for finger prick or should strictly be for veno blood draw. No? And we found that for these kits, we are able to use the finger prick method. So it's much easier to do. And then you get your results in 10 to 15 minutes no, from the time that the blood sample is put into the well within the cartridge. Okay, next slide, please. Okay, so this would be the initial results, partial results of the Sampaloc testing. Actually, as we're speaking, they are completing the Sampaloc testing today. So we will have the complete results by the end of day. But so far, these were the results as of April 25. So identifying the asymptomatic IgM. So this would be 4 persons who were identified to have current infections. They were also able to identify 15 persons who were also asymptomatic. But have had the infection and have recovered already and have some level of IgG antibodies. And then you also have, majority of the asymptomatics tested negative, meaning they have no infection and they have no, they don't show any level of antibodies. And this also tells the LGU that having the lockdowns and the ECQs have actually helped to keep majority of their population safe and healthy. And then we also had some individuals that were symptomatic negative, 27 of them. But because they were symptomatic, they needed to be seen again by the physician and then also recommended for either quarantine or for PCR swabbing. We, for those that were identified for the PCR swab tests, the Manila Health Department, they're still awaiting for the test results. I believe they sent the swabs to PGH from these individuals that were sent to the Delpan quarantine facility. So we are still awaiting the result from PGH. Okay, next slide, please. So we're, sorry, hello?
No,
Okay.
yeah. Oh, okay.
So
Good.
this is naman from Tondo, the Tondo testing, which was done on May 3. So about 1,400 400 individuals were tested that day. So again, you can see the setup, and then also even during the testing implementation, there's very strict implementation of or enforcement of the social distancing to make sure that test participants are, you know, are safe, and they won't be what do you call this, within the distance to, you know, to either infect each other, or this is also to give them a level of confidence that when they go to the test center, like in this case in Tondo, it's a public school, they're also confident that you know, social distancing is being practiced. They were also very cooperative, so mas less yung fear nila na baka mahawa din sila sa ibang tao who could possibly be infected but show no symptoms at all. So next slide, please. Sam? Yeah, so more pictures from the Tondo testing. So as you can see, they also have triage set up. So it's clearly enumerated, step 1, step 2, step 3, step 4, so that people are guided throughout the process. And the LGU and the Manila City Health team was instrumental in ensuring that the testing implementation was done on a very organized level and using all the protocols of Project ARK to the letter. Next slide, please. We just like to show you also the result, the initial result from the Tondo testing. So we were able to cover 1,451 individuals on that day using 4 public schools. So you can see here, so the Rizal, Tipas, Almario, and Tondo elementary schools were used for that day to cover this 1,451 individuals. Out of these, you can also see the test results where 62 individuals, although asymptomatic, registered positive for IgM, and then 24 for IgG. So for the 62 that were IgM, these are the ones now being also contact tracing is being done for them. Okay, this is an important step that the LGU takes, as well as quarantine and for PCR swabbing. As you can see, also similar with the Sampaloc results, no, majority of the test participants were registered to be asymptomatic negative, which again proves that the hard lockdowns implemented in Tondo, Manila were also useful to help safeguard the health and safety of people there. For those that registered as we also had 2 individuals that registered actually as symptomatic IgG and symptomatic IgG and IgM. And based on the protocols, because they're symptomatic, there really needs to be a clinical diagnostic done by the physician. That's why it's always important. You know, the test is just a guide, as Dr. Mingita always likes to say. The test is just a guide. You know, but if the person is showing symptoms, there really needs to be a clinical diagnosis done by the physician. So it's very important for medical teams or companies are implementing barangay testing, or even for your own employees, there must be a physician to oversee the testing so that then they can also weigh in on the management of the results and what to do with the person or what to do with the patient and what to advise with the patient depending on his or her results. Next slide, please. So all this data that we're gathering from the barangays is also going to be submitted to Project ARK and then to further submission to the DOH. And then, Jopin, I just wanted also to mention the other LGUs that are already in line for the
Yes,
testing.
please. Mm-mm.
So today, we also launched the testing for Antipolo Rizal. And then next week, we will be doing Makati, Pasig, and Quezon City. in phases, and then also Batangas, which has been identified by the Aboitiz group as a beneficiary, and then we're also lining up other LGU partners who are also very much interested to do the barangay testing. So as we firm up those partnerships with the LGUs, the team will also be announcing it so that everybody can be advised. So if you have any further questions or comments, you can reach out to any of the team members here with you today, so that you can be guided properly on how to do implementation for barangay testing to complement already what you are doing in your companies, testing your team members and your workforce.
Okay, great. Thank you very much, Kingay. I know George has to leave in a few minutes. So before he leaves, can we ask everybody, and before Dr. Mingita speaks, can we ask everybody to please turn on their video? And let's just do this this friendly picture that everybody is cooperating on this mass screening effort. So, all right. We have two screens, just two screens. So please put on your big smiles. And George, are you there? Can you please turn on your video? This is so before you leave. Helen, are you still able to turn on your video? Total, wala namang sharing of slides.
No, it's okay.
Are you sure?
Yeah, no, joke.
Oh, sige. All right. George, are you there? Hello. Okay. Anyway, so ano siguro we'll ask our creative team to arrange it. So can we put on our big smiles and make a thumbs up, because we are all optimistic that we are going to be able to go through this together. All right.
Sige, ma'am.
Sam, are we good? Screen one?
Yes, ma'am. Give
Okay. Ready?
one.
Okay. Yes. And then last.
Okay na.
Ready? Okay, good. Thank you very much. All right. So now we can start sharing the slides of Dr. Mingita. If you can start with a slide with the medical team. You know, this Project ARK was hastily put together, but even before the lockdown, Dr. Mingita and her team of doctors have already been thinking hard about this screening for the people. And with their generosity, they've shared their test protocol with us and just tweaked it to match the needs of this the barangays and the business community. Dr. Mingita. All right, we will unmute Dr. Mingita. All right. Naka-unmute. Could you?
I'm okay. I'm unmuted.
Okay, good.
Okay.
Yeah.
Okay, great. Good morning. I don't know if you've seen already Project ARK. Is it the first time for many of them, Japin, or no? They've already been with us, or they want me to start?
Only some have seen the project.
Show the slides then,
Yes.
no? Sam.
Okay.
Okay. You know, I gave a webinar 2 days ago for Manila House. It was their first ever webinar, and I talked about testing, and I said, in an ideal situation, if we responded to this pandemic the way Taiwan did or Korea did, or maybe Taiwan, we would have locked down our borders as early as January. We would have used 2 months to stock up on PCR test kits. We would be doing PCR test kits everywhere, and our results would come to us after 4 to 12 hours the same day, and with SMS messaging ba. That would be ideal. Unfortunately, that's not the situation. That's why we have to do this, no? And we have to be able to use our resources in such a way that we don't waste resources and we make the most of what we have. Now, as of now, Department of Health still prioritizes symptomatic people and healthcare workers. They will not test asymptomatics with PCR. And if you want it done, you pay. In the Red Cross is like 3,500, but if you call their hotline, it says 4,000, so you don't know anymore. My point is, it's not readily available. And if you want to test a lot of people, we needed to find a way. And we found a way through the rapid antibody testing together with PCR when necessary. So it's a strategic combination of both, okay? So this was our objective, to identify, isolate, and appropriately treat those with infection through IgM, to identify those already recovered and likely immune with IgG, then to trace and monitor their contacts, because if you find anybody positive, that means the likelihood of them having been infected or being infected right now, okay, is quite high. And to use these testing results for identifying persons who may be fit to work. If you look at the Department of Health Department Memorandum 180, they have an algorithm there. And in fact, they're even less strict than us. In their algorithm, if you see an IgG positive, even if they're still an IgM, they may go back to work. Kami, we only allow that talagang get out of jail free without any quarantine anymore if you're IgG positive. But if you're still IgM positive, even if you're IgG positive, we sort of quarantine you for a while, just to be sure, and then repeat the test after 7 to 10 days. But based on science, as long as you see the IgG, you're a recovered person. No? So that's the gray area. No? So our methodology is targeted sampling. We don't sample everybody. We sample those who we feel should be tested. And above that, you have the random. Can we have the next slide, please? Next slide. So what do you mean by targeted testing? So, okay, who do we test? We test those, whether they're symptomatic or asymptomatic, people who have been exposed, close contact with, known or confirmed COVID patients, okay? Those symptomatic or asymptomatic persons who have had close contact with patients who are probable COVID. These are people just awaiting results of their swabs. And as we know, unfortunately, it still takes a long time. People who, my friends, my colleagues, my classmates work in NKTI, for example, were complaining it's taking them 2 weeks. Dr. Cabral, her own daughter was a COVID suspect, PUI. She had to wait 2 weeks. She's a doctor for her results. I mean, it's still like that, no? So it's not right away. So sometimes you're waiting, sometimes you die, sometimes you're discharged, but you still don't have your results. So we test all these people who have come in close contact with such persons who are probable COVID, still waiting for the results. Then we also test symptomatic or asymptomatic frontliners, such as healthcare workers, persons who have jobs, as well as that are considered important to restart the economy. Those are security guards, also grocery workers, delivery guys, those who come in direct contact with the public, etc., etc. These are frontliners. We test them. We also test all who are symptomatic. And in our protocol, we included some symptoms of COVID that you will have to look into, or symptoms which will make the red flag go up. Okay. We also test those who are high risk, no? Even if they're asymptomatic. For example, the senior citizens who are sort of unhealthy and frail. We're finding that it's not so much the age, it's more the fact that when you get older, the likelihood of you having a lot of these comorbidities is higher. What are these comorbidities? Diabetes, hypertension, chronic renal disease, lung disease, cancer, and if you're in treatment, no? Those who are grossly obese with BMI more than 41, those who are on immunosuppressive medicines like post-transplant patients, no? Those with connective tissue diseases, autoimmune diseases, they are also on suppressants. So these are high-risk patients. We test them, okay? Next slide, please. Then above that, we try to have more we try to have more testing kits so that we can do a random sampling according to the density of the population. No? We can have a radius, no, that we can test in, and we leave this up to our statisticians to decide per barangay, per district that we test. Okay. So it's both a targeted testing as well as a random sampling. Next, please. So this is how we interpret our, basically, there's a simple graph, but this is the more complicated one. If you're IgM positive, no matter what, whether you're symptomatic or not, you should be considered potentially infected, okay? If you're negative, both IgM and IgG negative, that means you're presumed to not have ever had the infection. So you're okay, but we always counsel the patients or the persons that you may still get it, okay? This is a very simplified version, okay? Negative, negative means just you've never gotten the disease, it's presumed, and you're asymptomatic, you have no symptoms, so just stay in quarantine until we can all go out again for GCQ. And then if you are positive for IgM and positive for IgG, if you're asymptomatic, we still say isolate and swab. The DOH protocol will tell you not even to swab anymore, just isolate, no? Because in all likelihood talaga, you won't have the virus anymore. Because by the time you get the IgG, it's usually after 14 days. You don't get that before 14 days. Therefore, the likelihood of finding even the virus viable in your nose or throat is really very low. So we may have to revisit this and make it more consistent with the DOH, which is less stringent than us. Okay? Basta may IgG na, okay ka na. Pero, isolate pa rin, and then after 10 to 14 days, you can do repeat, and hopefully you no longer have the IgM, you have just the IgG. If you're IgM positive, definitely isolate and swab, even if you're asymptomatic. This is where we're strict because the DOH department memorandum says, if you're asymptomatic, you can just isolate. No, don't swab because now they're trying to save on the swabs. But we know based on science, based on the references we've read, that 80% of people who get COVID-19 are actually asymptomatic or just mildly symptomatic. So they never really get to the hospitals. That's why now China and other places like New York, they're doing now the antibody testing to see how many really got the disease. So if you're IgM positive, but asymptomatic, we still recommend that you try to swab if you have access to a PCR lab, okay? If you don't have any access to a PCR lab, then just isolate and treat as though they are infected. We are validating the kits, no? And as expected, the IgM kasi will rise starting about 3 days, but they go up really 7 days and onwards. That's why it's possible that when the PCR is no longer is negative, you can't find the virus. That's when you get naman the antibodies. That's why it's good to use them in tandem. So by 7 day onwards is when you expect to see the antibodies. I'm not yet done. Can we go back? No. And then finally, the last is negative IgM but positive IgG. That means you had the disease and you are recovered and you have some immunity. This being a virus, we expect some immunity. It's just a matter of how much. Is it total? Is it partial? And how long? Is it 1 year, 2 years, 3 years? So based on history, based on the fact that it's a virus, it renders some immunity. And this is from the IgG. This person will be advised, okay, you're lucky, you got it and you recovered. But it's not, you're not Superman either. No? You still have to practice all the precautions we are going to still practice after ECQ is lifted. And what are these? Wearing of the mask, washing our hands, cleaning our shoes, everything we're doing now. In fact, we have to be more careful because we will be going out. So when you get home to the house, this is another whole set of things that we have to remember once we are ready, able to go out and work. So more careful pa nga tayo dapat. Okay? For everybody, even the IgG positives. Next slide. Okay, so that's basically the medical protocol. Okay, and
Dr. M, would you like us to show your chart with the timeline for PCR?
yeah, that's a nice chart to show. Yes, please.
Yeah, okay.
That will explain a lot because in one's view, you can see the relationship of the virus to the antibodies. Yeah, that's the one. So this is day 0, no? Then you have your symptoms, fever. Although some people, as I said, are asymptomatic and sometimes they just have like a dry cough, no? Sometimes it's just a little weakness but no fever. So it's sometimes the symptoms are very mild and very vague, no? Your PCR, the advantage of the PCR, the swab, is that you can detect the virus about 2 days prior to the onset of symptoms. Okay, but it goes away very fast because what's happening here? Your IgM is rising. Your antibodies, that is your immune system which actually fights the virus. If you are successful in fighting the virus, by week 2, wala na yung virus. So if you do your swab at this time, you will most likely not find it anymore. That's why I have many friends, physicians. They were symptomatic. They were practically certain they had the virus, but their symptoms were very mild. They were just told to quarantine at home. But the person they got infected from ended up in the ICU. So they were allowed to have their swabs. Kaya lang they had their swabs on day 11. Okay? They were negative. But they came to see me afterwards. So this is IgM. If they had an IgM test, perhaps it would have come out positive, not the antibody, although wala ng virus. Then on day 14, after the IgM starts going down, your IgG naman starts going up. There's a time where you have both, as you saw earlier. No? You may have both at this point. But on day 21 onwards, you have your high IgG. No? And it stays up. No? You can detect it. This is just years na lang. We're not anymore interested here. We're interested here. Now, so you test. If you have this part, if you have your IgG na, wala ka ng virus eh. No? That's the scientific way of looking at it. Okay, that's why these tests can be complementary, and that's why some of the scientists actually recommend that when you go back to work, if you have access to a fast PCR, why not do a PCR? No, but if you have been in quarantine for 2 months, you have not been exposed to any person who's sick, you have not had any symptoms, you may just do every 2 weeks of the antibody testing so it can catch. No? Because anyway, when we go to work, we will still be wearing a mask. Okay, so even if we got it somewhere, it's not going to cause problems with other people. And if you're when do you pass on the what is the incubation of SARS-CoV-2? Before they said 14 days, but now most of it is within 5 to 6 days. You will exhibit the symptoms. That's why there's a logic to having the test every 2 weeks, because even if you get it here, you might not have any IgM, IgG until about at least a week after. So this is the relationship. At least you understand this. I think this is quite clear, di ba, Jopin? I mean,
Yes, actually, this is a very, very important slide for everybody
Yes.
to look at.
That's
Yes.
why you understand. PCR, great. Even prior to symptoms, great. But after the first week, the probability of getting anything, you might just get what happened to Senator Angara, like what happened in Korea. If you do get PCR, they're remnants of the dead virus. The PCR will still read it as positive, but they're dead. You don't have the infection. That's why you're better off with this. However, again, we always repeat, not all test kits are the same. You have to choose a test kit with at least a fairly acceptable sensitivity and specificity. And our validation tests are showing that talagang it's after day 7, no, that you get better results for the antibodies. Okay, so if you get a false negative here, it's possible, no? But again, that's why we need the doctors to interpret. Has this person been in lockdown for 2 months? Hasn't been exposed? Hasn't developed symptoms? In all likelihood, that person does not have COVID. But if this person is always outside, is a frontliner. The other day we tested a counselor from Manila. She's always going out. Okay, she came to the house to be tested because her husband is a family friend. And she had IgM and IgG. So talagang she had, but her symptoms were very vague. Headache, that's all she had. Headache some time ago. So we said, sige, magpa-swab ka. Pero sabi ko sa kanya, I told her, in all likelihood, you won't find any virus there because you're somewhere here already. IgG is detectable. IgM is still detectable. You're somewhere here, okay? So sure enough, there was no virus detected, but she had both antibodies. So you have to understand the relationship to know how come you have positives and negatives, okay? So that's basically it. Thank you.
Thank you, Dr. Mingita. And for everybody's benefit, after this meeting, we promise that we will be sharing information with you, including the test protocol, which thank you to Dr. Jean and Dr. Mingita. They've made it so understandable that even somebody with no medical training like me can understand it. But that said, it doesn't mean that just because you kind of understand it, you will administer the tests on your own. So, all right, now it's 12:04, and we're happy that our presidential advisor was able to join us to give us a few his message before we start our Q&A. So here is Mr. Joey Concepcion. Joey, we are speaking with the League of Corporate Foundations, which is composed of about 100 members, 90% of which are foundations in the Philippines.
Well, good morning or good afternoon. I guess many of you are wondering what will happen on May 15. There was a earlier text going around that I received about different levels of types of lockdown, facing phase 1 all the way till phase 7. So I asked Vince Dizon, who is now the Deputy Chief Implementer and the new testing czar, what was this fake news? And he told me it's fake news. But there's also a lot of talk now that it will be extended till I heard that. I hope it's a joke. June 29. I got a text from George. June 29. I think if we do extend, we will be really in trouble, serious trouble, no matter how big the stimulus package will be. To my mind, it's going to be useless if the economy does not start on May 15. And I've said this time and time that we have to start, we have to try, and we have to see what it is out there for our own businesses. How many people will be able to bring customers to their restaurants? How many people will be able to bring their customers to their parlors, to their nail shops? How many people will be buying cosmetics? We all know that essentials will still be in demand, and that's not the problem. It's all the other areas that also account for a big part of our economy. And for this really to happen, and we have assured our partners in government that the private sector will continue to do its part. Actually, I've shared this in so many different webinars that the private sector really has two choices. No? In creating visibility, we can do a lockdown because it creates visibility as to who is sick and not sick in 14 days. And actually, we are now on our 4th reset, which we have done. Basically, one reset is 14 days. So we've done basically that 4 times. China locked down for about 78 days. We will be at the 60th day on May 15. So is it enough? I think it is enough. I think we should try to experiment and see what happens when we open up. So the other way that is, to me, the least expensive is to do mass testing. And why is it the least expensive? We all know that locking down the economy cost us much more in terms of revenue generation, etc. So testing, how much is a test kit? It's about 450 pesos for the Innovita. And for the PCR, the swab test, it's about 3,500 to a high of 8,500. I'm not saying that we should choose one or the other. No, both are equally important. And I think Mingita explained it very well, that this testing method should be used in tandem. What has to happen really is that we have to start testing. And time and time I've said testing creates visibility. And as you have visibility, you can isolate the sick in quarantine centers. And of course, you have to trace who the person was with while he was not determined to be infected. A case in point is what we've seen, and I'm sure it was shared earlier, in basically Manila with Mayor Isko Moreno. So just to show you, about 68 people were positive in Tondo. Just imagine that 68, if we did not do a rapid test on them, they will be infecting people even today, and by testing, you create visibility. Now, of course, there are people who are saying that the accuracy is not there. Let's even discount that we were only 50% accurate with the 68, which I doubt. So that'll be 30 people, okay? That 30 people can still cause a lot of damage, especially in the barangays in Tondo. And before you know it, more and more people will just be infected. And once you cannot control the infection levels, then how can we ever get out of the ECQ? So testing is really where we are putting a lot of effort. Aside from the 1 million plus test kits that are arriving on May 15, and now close to almost 175 companies have joined, and I think more and more will join. That will now equip the private sector not only the ability to determine how many employees are infected, but will also give us the necessary data for us to be able to have greater visibility and track and monitor the different areas, whether it's Metro Manila or the entire Luzon, as we increase the number of companies doing testing that covers the entire Luzon. You can imagine that we will have data that can now spot green areas, red areas, or yellow or orange areas, so that we can really strategize better. Government will be able to see what barangays have the highest level of incidence of infection. And so that the battle, and we're at war with a virus that you can't see, testing is the only ammunition we have to create that visibility. So for us to avoid a second lockdown, and for us to be able to open the economy all the way till the day we find a cure for a virus, there is no other way but to really aggressively participate in this program of ARK. Now, I'd like to share with you that hopefully either tomorrow or on Sunday, we will also be helping about 6 to 7 government hospitals in improving the capacity for PCR testing. So that's being worked on by former Secretary Janet Garin. We have funding for all of these 6 to 7 government hospitals. And the idea is to increase capacity to a combined capacity of 7,000 swab testing on a daily basis. No? So that's the amount of capacity that will increase if we are able to put this project together. And the urgency is there because as the private sector moves aggressively in rapid testing, those that are confirmed to have IgM will have to have a confirmatory test using a PCR or a swab test. And what's important is that they allow asymptomatic patients to be tested as well, no? Because many of these people are also asymptomatic, and we should be able to get priority. And hopefully these 6 to 7 government hospitals, with our donation of PCR machines and automatic machines and all of that, will allow us some space for us to send our own employees, because that's part of the DOH protocol, and it's the right thing to do. So that is basically, in a nutshell, what I believe the private sector has to do. Moving forward, this is not a one-time thing. I think everybody here, every company has to be committed to testing their employees as regularly as possible every month, depending on the risk profile. I mean, our company, we will be testing them at least for the next 3 months, twice a month, following the Razon model, the first and third week of the month. No, that's what we're going to do. Now, others may opt to do it once a month, depending on your risk profile or the ability to afford these test kits. No? But we're trying to really make it more affordable, and hopefully in time, as the volumes go higher, the prices will go lower. So I am still confident that on May 15, that we will be basically having a GCQ. Now, there might be some isolated cases that will be under ECQ that are uncontrollable. We don't know yet. I hope that they focus more on locking down barangays, which is the right thing to do, the right approach. What Mayor Isko Moreno is doing and other mayors are doing is to focus on the barangays. So as we focus on the barangays, then commerce can still continue, no? And we can't afford to really shake down this economy. I know we have to be careful for the next round to be prevented. But then again, we will never know if we don't open the economy after 2 months. And I'm sure many of you are eager to see how your, especially those who have been locked down. In our case, we are an essential company in terms of food products. So we experience how challenging it is to really get employees to work, even with hazard pay and overtime pay. It took us about almost a month to get to like 80% uh, fulfillment in terms of manpower requirement. That long. Uh, and it's still a struggle until now because the fear is extremely high. So with the test kits available now, I think we will have, they will be more comfortable in working because they will be able to be assured that they are going to be tested. And I think if we show our employees that we care for their health by testing them regularly, then their confidence to work will be much, much higher. No? I think that's what everybody is expecting to have. No? And moving forward, we cannot just prepare a scenario that this is over in a year. No, I think everybody has to look always at the worst case scenario because your entire business model relies heavily on your cash flow, whether consumer confidence will lead to uh, them moving in buying your product or your service. No? So all of these are really up in the air until May 15 when we open our economy. Then we will now see how many of the restaurants will be able to make it. No? Is the fear going to be so high that they will not even step into a shopping center or restaurant? We all don't know. Uh, Even public transportation, how will people react in riding a bus? Will they wear face masks, face shields, gloves, PPEs? You know, we don't know. I mean, if they do, then great. Then maybe government can increase the density of the number of people riding public transportation. So let's just hope for the best. And we are here doing our very best to try to open up the economy. I mean, it's been a long 2 months, especially for myself, trying to explain the private sector's position with government that we eventually have to open up. You can't be too detailed of what we can and with what we cannot do. We have common sense. I think we know how to prepare our own production centers. We understand social distancing. We understand many of the other precautionary measures. In fact, we're going far beyond by, despite DOH saying that, you know, rapid test is not going to work. Why waste your money testing all your people? But then in the end, I mean, as entrepreneurs, we are born to protect our business. We have common sense. We are street smart. And that's why we've reached this level of success. So I think government should not treat us like children. We are socially and responsible to our country to make sure that we protect not only our livelihood, but the lives of every Filipino out there. And that has been my message to media, to cabinet, and key players, decision makers who are going to decide as to whether we go down to GCQ on May 15th. Thank you.
All right. Thank you very much, Joey. Now, some of the members or some of the participants in this meeting have actually signed up to Project ARK, particularly, I mean, if I can mention a few, of course, Aboitiz Foundation, Metrobank, GT, and so on, and SM. Now, we'll follow through with what Helen and Avik were saying before the meeting. And then we'll ask you to maybe start off the questioning, and then we'll take it from there. So, Avik?
Yes, hi, Ms. Jovin. Good afternoon, Sir Joey. Just maybe a question in general, especially for those who would want to take part in Project ARC. So in terms of what would be the next steps, let's say, for example, me and you foundation, I would want to uh, join Project ARC. How do I, let's say, order? Do I just donate to Go Negosyo, sorry, to the group, and then they would be the one to allocate to the barangays, coordinate with the barangays, etc. What would be the next steps? so that we would know in terms of what would be our counterpart in terms of the work to be done.
Okay, maybe to contextualize the question, because Joey wasn't here at the beginning of the meeting. Joey and Dr. Mingita, the foundation or the league is saying that beyond the giving food packs and then cash donations, they're now thinking of supporting the barangay effort of Project ARK by giving test kits. So earlier, the health committee and the head of the league was asking if about this. I mean, how they can do this efficiently, and it will be in sync with what we're doing.
So
So
we have
yeah, go ahead.
basically outlined. We're finishing with Manila, Sampaloc, and then a donor is stepping in to continue supplying test kits in Manila. The arrangement with not only the private sector, you people who are testing your employees, but the LGUs, all data has to be collated by our group. No, if you don't give us the data, that we will miss on that very, very important part, no, which is to consolidate this all and be able to map it properly. So let me reiterate, I forgot to say that, please, all those participating in ARC, we don't really care where you buy your test kits, provided that they are ideally IgG, IgM, and then provided that they are FDA approved. And what is important, we'll support you. We will include you in all our materials that you are part of ARC, and just provide us that data. And I think George is heading that committee. As to the whole plan that we are planning to on the LGU execution, the idea is to focus on NCR, Calabar, and Central Luzon, the areas that have the highest level of concentration of people in barangays, number one. Number two, and the areas that contribute a lot to the country's GDP. And then moving outward, so far, this can even go beyond the different provinces in Visayas and Mindanao, even as we speak. So we can help there. You may have to help us with your own mayors if we have no connection with them. Not all mayors, by the way, agree with rapid testing. There are a couple of mayors who only want to do PCR, RT-PCR testing. No, I mean, Governor Jovic is firm about that, but some of his mayors are open to do rapid test. So it depends. No, it depends on how open the mayors are, and for now, I think Jingay has the list. I think we're doing QC. Maybe Jingay, you can answer that.
Yes, sir. Actually, I advise that we are currently doing now Antipolo, and then next week Quezon City, Makati, Pasig, and then we also have Batangas in the pipeline, as well as trying to partner with other mayors in the Cavite and also the Laguna area, and possibly also Bulacan, because we've been asked also to make sure that we can cover Region 4A, Region 3, and NCR.
Okay, good. There is a question, I mean, in addition to what Avik just mentioned, because there was a question about people here in this meeting are also from Iloilo, from Region 5, from Cebu. So they'd also want to know how they can help in those areas. If they understand that our priority now is NCR, Region 3, and Region 4A, but they too have cases there. So can they help in those areas?
Yeah, of course. If they know the mayor, especially, and they get the conform with the mayor, then and they will donate the test kits directly to them, we can help them with the proper protocols. I mean, Jingay and the rest, you guys can handle that support, and including the data as well. We will give you whatever we have, no, to help enable you to work with the LGUs. Normally, most of the LGUs handle their own execution. No? We actually just provide them the kits and the data form. Am I right? I mean, Jopin, we provide that form. No?
We do provide that form, which right now is a manual form. It's a paper form developed by Dr. Mingita and her team. And then George and Microsoft and Thinking Machines, we are now collaborating together to make it an online form so that we can submit this on a daily basis painlessly. So well, maybe I can share this with you now with everybody, and George, I mean Joey too, and me, Jingay. In the meeting right before this meeting, IATF actually offered to help with some LGUs where we are having difficulty connecting with the LGU executives. So if there are,
Wonderful.
yeah,
Really,
yes.
huh? Finally.
Really? Okay.
General Padilla was in that meeting, and he said that
Si Resty.
if we
Oo,
need help.
Padilla.
So they're asking us
Yes.
for the list of LGUs where we need help.
Sige,
So
I'll message him na I have his number. Si Resty
excellent.
Padilla, yung spokes nila. Okay, sige. Totoo talaga. Okay.
Yes, yes, yes. And
That's a
you,
major change, huh?
yeah, and send us that a number. Well, kasi they wanted the MMDA to organize an NCR-wide meeting of mayors. And
Yeah.
George and I were saying, wag na pong lahat-lahat because each mayor wants their own way of doing things, just like Joey is saying now.
Yeah. Kanya.
So, and it will help really if the companies and if the foundations who are close to these LGU executives will also do their part in talking to these LGU executives, because then the persuasion is more friendly and more how would you call this? It's stronger. Okay.
So after every engagement and during the testing, like in Manila, we will call for a press con as the results come out, and the effect is quite good. I mean, the mayors engage, and we engage, and it promotes also the collaboration between the private sector and the LGU, and the donor, of course, gets the credit for donating the kits as well.
Okay, great. Dr. Mingita, Pfizer Foundation has a question regarding the sensitivity and specificity of the test kits to be used. What is our recommendation is the question.
You mean a recommendation for the specific test kits?
Yes.
Or,
They
okay,
understand that test kits are not created equal. So
I
what's
know,
our
that's
recommendation?
true. Actually, we would have loved to use Healgen, but Healgen is an American trademark made in China. And now it was the first kits that I had that I actually advised Soler to use because I studied it, no, and it was correct because it has a very high sensitivity and specificity, about 99% specific, no. But the thing is, they're not allowing China to export to us anymore. They're all going to the US. Now, Zhejiang Orient Gene is actually Healgen in disguise, okay? We are now using them, and but we're still checking if it's really same as Healgen, okay? If it's the same as Healgen, it should be good. CTK Biotech, we just got, they have arrived, Jopin, the kits?
Yes, they are on their way to you. The sample
Okay,
kits
great.
are on their way to you.
CTK Biotech, we found them by checking the website Find. It's a website for all tests, all trials in the world, okay? And it's made in the USA and was validated in a very reputable institution in Denmark. And when we saw the performance, it's even better than Healgen. This is validation, a very stringent validation against ELISA, against PCR, etc. No? And a very high specificity, about 99%, 98%. I mean, that's where we're looking at, okay? Based on independent validation, not based on the company or leaflet validation, which is always better than it really is. No? So CTK Biotech, I would use for myself. So I've gotten some for my own family, and I'm going to send to PGH for validation. Okay. Another thing is Innovita. Okay, Innovita, we are validating. No, if you look at Innovita in some other countries, the Find website, it doesn't do so well, but in the Makati Med local studies, it was their best performing kit. It even beat Healgen and it beat Biolytics. It was Innovita, Biolytics, and Healgen.
Yeah, the numbers, ma'am, were 92, 96 for Innovita.
Yes, 92 sensitivity, 96 specificity. That is okay. No, that's for IgG. For IgM, IgM is always less sensitive. You remember that because IgM rises on the first week. And it also depends when you do the test. We've also found out that phase 1 is the first 7 days. You may not always get the IgM because it's rising. No? So you get them in the second week, and then as you wait longer, then you get more. So that's why it's good for mapping for people who are asymptomatic and just missed. No, okay, they're just walking around lingering. No, so Innovita for the IgM, it's like about 75% sensitive, but about 96%, 97% specific. So if you get a positive, you're almost certain it's a positive. Okay. Now, if for the IgG though, it's always higher. In all these kits, the sensitivity and specificity of IgG is always higher than the IgM. The IgM though, the specificity is high. Therefore, if you get a positive IgM, the probability that it is really COVID is also very high. Okay, so those are the ones. Zhuhai, Livson, we're still testing. We don't have any data on Zhuhai, Livson here locally. I spoke to some people in Australia. We had contact with Australians because of my constant communication with Gisela Concepcion. Now, she's the president of the Phil-American Academy of Science and Engineering. We're in constant communication about these test kits because they also believe they should be used strategically, and they have their own protocol. So they said in Australia that Zhuhai Livson should be good. No? Because of the way the the reagents are made, but we're still testing that. So right now I can say CTK Biotech, Innovita, Hilgen, Biolytics, Vasan Biolytics is being used by the Philippine Heart Center. It's also being used by the Ayala Group, correct? Am I right?
Yes.
So in the Makati Med ranking, it was number 3. In our validation, I have to ask for some forgiveness because the Innovita statistics given to me yesterday were incomplete. It didn't have the date of the PCR, so I cannot feed it for evaluation. Okay, and aside from that, Dr. Cabral gave them some other kits to also validate before ours. So naunahan sila. So I'm still waiting for the Biolytics and the Zhuhai, Livson, wala pa. No, I have only the Innovita, but it's incomplete. But so I'm basing it now on the Makati Med evaluation. Okay, so those are the kits. I cannot speak about the other kits. Okay.
No, thank you.
There's
That's
so
really very helpful, ma'am. Shem, are you still here? Would you like to ask your question? Yes, Shem.
When I brought up the thing about outside of NCR, part of it was the barangay testing, but part of it is also because, for some of us, our head offices are outside of Metro Manila, so it's more on like the HR staff testing and stuff. If help and guidelines regarding that is available for those of us outside of NCR and Luzon.
Right. Our test protocol will be sent to this group, and when you see it, you'll see how it applies to your company, or even to the barangay surrounding you. Now, as to we're also very transparent with the suppliers that we have, and you can call them directly. We negotiated bulk pricing so that any company that is with ARK can enjoy the best price. In fact, because of what we're doing, from a high of 1,100, 1,500 pesos per test kit before, now we're enjoying as low as 450 for the really good ones, like the Innovita that Dr. Mingita said. So the transport of this for your needs outside of NCR, you can just coordinate that with these companies. These are solid companies with established logistic network, because they're mostly pharma and medical devices suppliers anyway. So they can help you in that way. But what is foremost is that when you're designing for your needs, please refer to the test protocol. And there we do medical briefings every so often, especially as for the LGUs and the barangay focal persons. So we usually announce those schedules in the focal group of the ARK companies, and you can join those as listeners. We usually encourage the medical practitioners to be the ones to ask questions, and the other members of the company or foundations to listen in. So that might help. Okay. So it's now 12:34. Yes, ma'am.
I have to go.
Yes, ma'am. Okay.
Now, one more word about Celex. Celex is supposed to be a very good brand. It's the only brand that we have here that was given US FDA EUA. Unfortunately, again, we're having a very difficult time sourcing it. There are some dealers uh, who are collecting money in advance, and I included it in when people ask me. I give them our table, then I give them the contacts of this Selex because you may want to contact them yourselves. But those who gave money haven't received them yet, and they were told it's coming on May 22 to 25. But we cannot vouch for it because we don't really know if we can get it. No, I wish we could. The Chinese well, one government official, a high-ranking government official, was dealing directly with the Chinese health minister, who said they would help us get Celox. And later on, out of the suddenly, nope, no more. So I think this is going to the U.S. again. Okay, either that or they're not selling at all. We're sort of caught in this trade war. So we wish we could get Celex, but we can't. Okay,
No,
Roy,
but that said, Dr. Mingita, I think we're lucky enough to be, because of what they're seeing the private sector do,
yes,
we are now being approached by many reliable
yes,
suppliers.
correct.
This morning you got, I sent you materials about Roche, which
And
is has
very
been
good.
making waves in the news globally
Yes,
of
Roche, yeah.
99 and almost 100, almost perfect.
Specificity, yes, we want that, Roche. And what about Abbott? Is there also an Abbott brand? No.
There
Or
is an Abbott brand, but no, that will stay in America for the
okay,
foreseeable
Roche
future.
is coming. And another thing is we have some South Korean brands that we will be able to get a steady supply. And again, they're showing very good results. So these South Korean brands, I'm kind of more confident about the South Korean brands than unknown Chinese brands. So, and at least we have promise of regular supplies.
Right.
There.
So the CTK Biotech, at least we know that it's 99.6 and 96.9% in terms of specificity and sensitivity.
I think the specificity is 99.6 and
Yes.
sensitivity is 96 point something. So it's
Yes.
quite high.
Yes.
So really high. Yeah.
So hindi na po tayo agrabyado. I mean, I think we're in a good place because we are getting these reputable and excellent test kits available to us. Now, it's now 12:36. We will end this session in 4 minutes at 12:40. So that's 10 minutes more than what we've planned.
But Jupina, I must leave because I have another meeting to go to.
Sige
So
po.
if there
Okay,
are any more questions, I'm just here. Just tell Jupina, okay? Thank you very much.
Thank you very much, ma'am.
Okay. Bye-bye.
So, Geoff, you want to ask another question? Jeff?
Hello.
Garcia?
Hi, everyone.
Yes.
Okay, so good afternoon. So just like to again, I also posted in the group chat, but I can say it again. But probably this can be considered more as like a screening tool. I mean, because from my perspective, I'm more familiar with HIV testing. Of course, in HIV testing, in general, there's a rapid testing, and then it's going to be once, of course, there's a it's not, the term is not confirmed, but it's more for screening where they will be confirmed at the National Reference
It's like a
Laboratory.
pre-diagnostic tool. Yes.
All right.
Yeah.
Okay.
No. Yes,
so in
that
a
is
way,
how we are positioning it. But at the same time, if based on the test protocol and on the chart that was shown by Dr. Mingita, at a certain point, the infection will not be seen anymore, even if you use a PCR confirmatory test. Remember that chart with the number of days? So even if you do a PCR test, you'll probably be just wasting the effort at a certain time, because then the infection will not be there. Then you will be testing not for infection, but for the presence of antibodies. So that's why she was saying, since let's see, for example, the situation in the Philippines, where all of us have been on lockdown for 60 days. Assume that we were all very good citizens and did not go out of the house and just kept to ourselves. So we had no outside contact. If we had COVID at the onset, say in March 16 or March 14, and we did not even know that we had COVID, well, whether we knew or not, we had symptoms or not, by this time, which is almost 60 days from the lockdown, we would most likely not have the infection anymore. But to know if we actually had the infection, it's good to do a rapid test on yourself through a doctor or a nurse that will help you administer it. And if you are found to have IgG antibodies, then you would confirm that you actually had COVID and have recovered from it. I think that's what she was trying to explain earlier. So, and then if you do a PCR now, 60 days after you presumably had COVID, when you had sniffles or you had diarrhea and all the headache and all of that stuff, you would definitely get a negative result in your PCR because the infection is no longer with you. So remember, she mentioned that used to be people were saying, or scientists were saying, the station of the COVID infection, or SARS-CoV-2 COVID infection is like 14 days. But now they're discovering that it can be even shorter. So definitely at 60 days or 50, 45 days, it will no longer be in your system. Okay, so I mean, there is always the timing is very important. That chart, we will also share that with you. So when you are planning what test to use and when and who organizations, then you have guidance as to what the best pathway should be. Okay, all right, I hope that clarifies, Jeff.
Yeah, sorry, just additional question. So in a way, if I think what I'm looking at of course from a program's perspective is that I think uh it's also crucial for the buy-in also from the LG as well, because I think they will also be the ones to, again, to help set up the referral systems all the way, at least if we, example, if we do adopt a barangay.
Yes.
So I think this was also mentioned by Sir Joey earlier. So I think this is something that's very interesting from our end, and probably we'll discuss this amongst ourselves with the team, and probably see how we can find a common ground for the program. But I think yes, the program is very helpful in its own
Okay,
sense.
great.
Yeah.
Well, thank you then.
Yeah. Thank you.
So it's now 12:41. Helen, would you like to give the closing remarks so we can end our session? You're still there.
Yeah. Thank you everyone for joining, no. Pero siguro I will give the floor to Abby kasi moving forward, it will be the health committee who will take the responsibility together as the whole LCF, no. We support naman what the health committee will actually looking or moving forward, what will be the the goal or ano yung action na gagawin. Maybe Abik?
Yeah. So again, thank you for everyone, especially for Project ARC, for giving us this briefing today. We thank you, all of the foundations who and companies who attended today. Moving forward for the LCF Healthcom, we will be discussing na lang separately, and maybe those companies who attended today who would also be doing barangay testing at your areas. You can join us when we will call for a more consolidated discussion on our end before moving forward. So we thank you for this, and happy lunch, everyone.
All right, great.
Jopin, if I have to add, no, some of the, I think si Miss Cecil left na, no, but I think most of the members of LCF who are actually into Project ARC are also, some of them are in our board of trustees.
Okay.
So the health committee and all of us, maybe we can discuss it also with our board of trustees, how we can actually move as a group, no, as a collective LCF. Okay, thank you.
Great, thank you. Gingay, would you like to say something about the donations and things like that? Because I know you're still coordinating that for IATF. Are you still
Yes,
there?
we just like to express our gratitude and appreciation to all the companies that have been so supportive of everything that's related to responding to the COVID pandemic, and all the issues that we find ourselves in. And we just like to continue encouraging the companies and your foundations to hopefully also support the antibody testing as a way to screen further for our communities and general population. So if anybody needs any more information or guidance, we're all here together with Jopin and the rest of the team to provide you that assistance. So hopefully together, we can continue working on all these solutions and eventually, heal as one, no? Beat COVID together. Thank you.
Alright, great. Sige, maraming salamat po. We hope to see you again. We hope to talk to you again soon. Bye-bye.
Thank you po. Bye-bye.
Salamat po.
Hi guys, thank you.
Happy lunch.
Thank you,
Thank you
guys.
po.
Thank you.
Salamat
Thank
po.
you. Thank you, everyone.
Thank you.
Thank you.
Bye-bye. Thank you.